And what is it that you enjoy the most about your career?
Um, it is working with my patients, getting to really know them because of the program, I work with patients for several months. So I get to know them. I get to see them make progress. And it is really, really, really rewarding to see them on the other end of surgery when they've lost all this weight and just even to see them the type of questions they have and see how much their lives have changed and like it's like a different glow about them after surgery. So that is definitely the highlight of my day, seeing that I can have like a small impact on someone else and them really changing their lives.
Okay. And what would you say is most challenging?
um, it's a couple of things. One, it's the healthcare system. I kind of heard something about that being mentioned earlier, but healthcare insurance is really, really, really hard to deal with. The system is definitely broken, and I will see people that really need help, need care, and don't have access to it, especially nutrition services. A lot of insurances do not cover dietary services. So people have to rely on, social media or magazines or what they read on Google to get some of the information. And yeah, some of that information can be great, but not all of it is applies to everyone. It has to be individualized. Also, this might be more specific to New York City, but New York City is a very large city and it overwhelms the healthcare system. So I work in a very high volume program. I see a lot of patients, a lot more patients than dietitians in maybe like Georgia or Michigan, that are smaller cities. So it can be overwhelming to just kind of have a never ending list of patients that I have to work with. Um, and then the patients themselves can be challenging. If they're in this program, they tend to have a lot of medical issues. Some of these people decide to have the surgery and they're ready for the changes, but majority of them are not. So a lot of times they are not at their best. So, they feel there's a lot of stigma with obesity. So it can be really difficult to work with them because they've been hurt in the past. And it's just trying to find that way to connect with them so that they know that we're on their team as well. So yeah, just working with people in general is going to bring that up anyway, but it's rewarding to see these patients make these changes, but it also can be very challenging to work with them.
Make sure to check out the My Career tab on the BC Navigator app, where you can track your career progress based on the amount of credits you've earned, stay updated on upcoming events from the Magner Center, and watch our videos for insight and advice on your career field.